Hey Zach, how's it going?
Hi, McCall. I'm good. Thanks.
Yeah, thanks for being here.
Yeah, no problem.
Okay, so I have a 21-year-old female softball player.
Okay.
She has a current slap tear, and it's in her throwing shoulder. And she was diagnosed in the off season before I took the job here. And
Okay.
we our goal here is to manage the slap tear and manage her pain and symptoms as she goes through the season, because her and the physician had decided that she would rather play than get it repaired and miss part of her senior season softball.
Okay.
Her main complaints are with long toss, and as we've gone on, we're about mid-season right now, and as we've gone on, she's continued to the toss and the pain that she has with throwing has gotten shorter and shorter. She
Okay.
also has a lot of post-practice soreness. And then she also has a history of a bicep tear or tendon tear that was about 2 years ago in the same shoulder.
Okay.
She's definitely has limited internal rotation and quite a bit of external rotation, which isn't that odd in a throwing athlete, but she has about 155 degrees of total arc. So, the goal is 180,
Right.
which she's lacking quite a bit in.
Okay.
She has definitely like a rounded shoulder posture and some significant scapular winging. When I did some scaption with her, about 7 or 8 reps and definitely less than 10, she started showing a lot of winging and a lot of different scapular kinesis issues. But strength seems to be fine. In the normal motion, she has full strength, no issues there. She has no issue with offensive activity, so running or hitting is completely fine.
Okay.
We've been doing regular stretching and trying to limit her practice participation, but we're getting to the point that she can only practice about once a week, if that. We've also been doing a little bit of manual therapy techniques, instrument assisted. I've been doing Graston and normal massage, as well as myofascial decompression, and always icing after activity to kind of help with that soreness. And she's coming in for strengthening and stabilizing exercises about 2 to 3 times a week. The only issue is she's not getting any better, and I don't necessarily expect it, but she's almost getting worse. And I was wondering if you had any advice on, dealing with her management.
Yeah. Yeah. I think there's some things to focus on. And maybe you mentioned this a little bit, but really some of those exercises that you're doing, maybe focusing on specifically that scapulothoracic joint. And then I would also check the pec minors to see if there is some lack of flexibility in her pec minor. I know that can contribute to some of the deficits, can contribute to pain. And then, it may be worth looking into kind of along those lines of kind of this upper cross syndrome, where we have kind of a tug of war between tight and weak muscles in both the front and the chest and in the upper back. And that may be able to allow you to assess where she truly is either weak or tight, and gaining some of that full arc back. So I would say that would be one of the main goals right now. Mid-season, unless you're going to sit her out,
Yeah.
I don't know that pain gets a whole lot better.
Yeah.
Maybe the pain will decrease with that increased flexibility if you find out that she has some tightness in those muscles. And it sounds like she does. If she's already presenting as kind of a rounded shoulder, I would suspect that she has some tightness in the chest muscles, particularly the pec minor. What kind of imaging did she have done to diagnose?
They did an MRI and found the slap. And then that's kind of when, she sees our doc when he comes to campus. He comes once a week, but she's been seeing him maybe every other week, just to kind of, go make sure everything seems to be okay and that it's not getting worse. And he doesn't seem to think that, the tear is getting larger or anything like that. How he knows that, I'm not for sure. But yeah, originally it was an MRI and they found it, and then they had made that decision without really consulting with our staff too much.
Okay. Yeah, the other concerning thing for me would be if pain is getting worse, is there a possibility of the bicep tendon becoming involved, especially with that slap tear? And if she's had a history, it's quite possible. And if it wasn't present on the initial MRI, but has slowly developed, that I've seen cases with baseball players where that has become an issue.
Yeah.
An arthrogram may help. Maybe the discussion needs to be with both the patient and the physician about a re-imaging to see where we're at, to see if there's been any structural changes, because that biceps tendon, that can bring on a whole nother host of problems. So you may want to think about discussing that with the athlete and with the physician present as well. A couple things to think about as far as functional exercises, things that I've seen as being beneficial, like a seated medicine ball throw, or like a Y balance test for upper extremity. Those are two functional type tests that I will do in my rehab progression that I think might be beneficial. The other thing is, if you feel like this is a postural issue as well, obviously we have the slap lesion tear. If we also feel like it's a posture thing and we want to correct that, another thing you may want to look into is kinesiotaping. Kinesiotaping, although it doesn't have a lot of evidence to back it up, one of the reasons that it's used is for postural correction. So it may be beneficial to help keep her in a position that we get her in. So we do rehab exercises. We do some of the release therapy, Graston techniques, and then after that, we apply the kinesiotape to help kind of the muscle memory of keeping her in more of an upright posture.
Yeah.
Maybe something, and she can play with it. She can practice with it. She can shower with it. If you have anybody on your staff that would be able to do that, or seek somebody out in physical therapy that may have that, that may be a solution. Yeah. One other thing would be, have you done any kind of patient-related outcome measuring tools?
Yeah. So I've been doing a dash, and I've definitely seen also, supplement it. I kind of started doing this a little later as I learned about the tool, but also the fast. And the fast is a little more specific to athletes, specifically baseball players. So, but in the dash, in her normal activity, she hasn't really seen any decrease in function, as in what she does outside of sport. Which is pretty interesting. I don't have the numbers right in front of me, but I can, general note is that, and then the fast, she's obviously seen decreases in her in-sport function.
How about her quality of life assessment? Have you been able to assess how she's dealing with the injury?
Yeah. So that within I'm not sure I've actually looked at the scores within the different patient rated outcomes, but I have a lot of conversations because we're together a lot doing rehab. So I've had
Okay, good.
Talk to her
Mm-hmm.
a lot, and she definitely complains of some issues with sleeping, so that's affecting her. She also has another job working, so she's works in the morning, then goes to school, then goes to practice. So she says she's tired a lot. But then there are certain things, like we have tried a little bit of kinesio tape and like even some myofascial decompression, and she told me how cool it was the other day when she was out hanging out with friends. She had big marks on her shoulders, and somebody else that she was hanging out with had the same thing. And so she's almost taken a little pride in her rehab and what we've been doing, and she has her up moments, but then definitely some down moments where she just feel like she can't perform the way she wants to.
Okay. And how has the coaching staff responded to all the stuff you guys have been doing?
Yeah, so I've gotten a lot of grief from them. Specifically, the head coach. He's been like, "Well, when can Abby come back? When is she gonna?" And I keep reminding him, this is a long-term process of just managing and continuing to manage and just making sure she's in the games. But then he is really upset when she's not there to be in a placeholder for practice, whether it's like standing in the outfield or something, because I've been taking her out and doing some rehab as she can't participate, the things she can't participate on. So we've been really struggling back and forth on him understanding our plan for her throughout the season.
Okay. One thing that may be beneficial as far as the coaches go, maybe being getting them more involved with understanding, how some of the objective data that you've collected through the patient-related outcome tools. If a coach can see that data, then maybe they'll be more understanding to the process.
Yeah.
Is there anybody, and yourself included, that feels like this plan that you have is not working and we should move forward with surgery?
Yeah. Talked to her about it, and even talked with her permission, obviously, with her parent, her mom, about it. And I've said, whatever, but the physician isn't concerned that this is going to affect her, and that as long as we do surgery, directly after and as soon as we can after season, that she'll be okay. And so they continue to take the physician's advice.
Yep.
Even though I know she's having some issues. So I've continued to try to fight for that a little bit, but all I can really do in the meantime with, what we're doing and the, determined physician to get her through season is I'm trying to work on her, like you said, some posture things and some strengthening things that once she's to surgery, she might not be as bad off before surgery, and we can have a good basis for her to recover after.
Yeah, maybe just a quick literature review, if you can get some numbers. I know I've worked with some SLAP lesion tears before. So, for position players, depending on the severity of the tear, early surgery has been shown to be 85% effective when we're rating patients to return to previous level.
Yeah.
So, if you can gain some of that, I know it's kind of mixed in the literature, but certainly that might be a discussion to have. It doesn't look like we're making a lot of progress. So can we move forward with surgery? Of course, I think that would be obviously for the patient to decide if that's going to make her happy moving forward.
Yeah, and assessment of how their season is going. Also, if they're making postseason, that's obviously going to change her mind. So as we go, we'll have to assess that and see if there's any, new stuff that
Sure.
she thinks, maybe it is a good idea for surgery.
Yeah. Yeah. Well, I think what you guys are doing, or what you've been able to do so far, is definitely on the right track. Maybe you can take a little bit of what I suggested and see if that helps. But good luck. It's a difficult case.
Yeah. All right. Thank you so much for all your help.
No problem.
All right. Talk to you later.
All right. Bye.